Today, I'm joined by Dr. Gianfranco Parati, President of the World Hypertension League and Professor of Cardiovascular Medicine at the University of Milan and Bicocca, Italy. Welcome, Professor Parati.
Hi, welcome. Thank you for the invitation.
Accurate blood pressure measurement forms the cornerstone of a hypertension diagnosis. Now I want to ask you, which devices are most reliable? What is the best way of measuring blood pressure depending on the different contexts?
Thank you for this question. That's very important. Hypertension is a condition which is defined by high blood pressure levels. So the accuracy of our measurement is fundamental for diagnosis, management, and cardiovascular protection. So the first step for anyone is to know our numbers. So people should know their values. This can be done in the doctor's office, and the doctor measurement is very important, has to be standardized using automated, validated devices. We are not recommending any longer the stethoscope with the classic auscultatory approach because there are possibilities for many errors. And we prefer to go on something automated, but that's important, using validated devices. 82% of devices on the market are not validated. So we have to check websites where there is a list of validated devices. That's the first step. Step number 2 is to do this in a standardized manner, being seated at least for 5 minutes before, then having in the office 3 measurements repeated over time, at least 1 minute apart, without talking, without any noise around, in a comfortable room, being seated properly. But this is not enough, because in the office we might have some emotional reaction, the famous white coat effect. So we ask to have also blood pressure measurement outside. This can be done very easily at home. Patient can buy these same automated devices, validated. I need to reinforce this concept, and doctors should help patient to choose the right one. Then they should do the measurement again standardized, seated properly after 5-minute rest, without drinking, smoking, eating, exercising for half an hour before. And again, in a silent room without talking, they should take the blood pressure a couple of times in the morning, before eating, before taking pills, and in the evening, before dinner. During the week, in general, this can be done twice or 3 times, no more. But in the week preceding the next visit, can be done for morning and evening measurement every day. We can also add ambulatory blood pressure monitoring for 24 hours. This is an additional piece of information, can tell you what happens in daily life during the day and during the night, which is very important. Nighttime blood pressure is probably the best predictor of outcome. So we need information on that. And this can help us to identify also the so-called masked hypertensive, those who have blood pressure normal in the office, but elevated outside. Also, home blood pressure monitoring can tell you something about this. But there are different perspectives. At home, you are seated at rest. With ambulatory monitor, you are in your daily life, so you can be exposed to the challenges of daily stress and to what happens during the night. Last but not least, be careful about the new technologies. There are many cuffless or wearable devices being proposed. This is probably the future. We are very much interested in them, but at the moment the cuffless device is not being validated properly, so they are not recommended yet for clinical use.
A very important message. And of course, we hope that World Hypertension Day helps to raise awareness around hypertension, but also around accurate blood pressure measurement.
Absolutely, that's very important.
Thank you so much, Dr. Parati.